The People's Business is made possible by our partners, Solar Dynamics, the most efficient energy systems.
Good evening, I'm Shane Jones, and welcome to The People's Business. Crazy, mad, he heading good. These are all words and phrases we've heard many times, all too often, to describe people who have challenges with their mental health. However, the world is changing, and there's more information on mental health issues now, so we know better. So since we know better, it's time that we do better. Tonight on The People's Business, we seek to further educate and explore the topic, time to invest in mental health. And with everything that's going on right now, the COVID-19 pandemic and the effects of La Soufrière's eruption in St. Vincent and the Grenadines, it's timely and extremely needed. Joining us virtually to help us get a better understanding of everything that's been going on and the major issues surrounding this topic are Camille Evelyn, who is a creative director and mental wellness advocate, consultant psychiatrist, Dr. Sylvia Lustrick, Jomo Phillips, who's a clinical social worker and couple and family therapist, Dr. Shanna Marshall, specialist, the family physician, and Carol Hollingsworth, who is a Barbadian diagnosed with bipolar 1 and founder of the BiYOLO organization. Ladies and gentlemen, thank you so much for joining me tonight. Well, we will get right into the discussion after this break. Welcome back to The People's Business, and as we said, we are looking at the topic, time to invest in mental health. And once again, we have joining us virtually Camille Evelyn, creative director and mental wellness advocate, consultant psychiatrist, Dr. Sylvia Lustrick, Jomo Phillips, clinical social worker and couples and family therapist, Dr. Shanna Marshall, specialist family physician, and Carol Hollingsworth, who's a Barbadian diagnosed with bipolar 1 and founder of the BiYOLO organization. We have a packed panel tonight, and we expect some good debate. Let me begin by giving everyone an opportunity to give their opening remarks on this extremely important topic. Where do we stand in Barbados with regards to how we deal with mental health? And specifically, you can talk about your role with regards to mental health. Dr. Lustrick, let me start with you.
Thank you for having me here. I think, as you said, today is a very, very special day to speak about mental health. My role, I am a psychiatrist, and as a psychiatrist, I'm a medical doctor first, and then I specialize in psychiatry. That means it's 11 years of studies at least, and I work as a consultant at the psychiatric hospital, where I'm in charge of pretty much all the females that are in the hospital, whether they are young or old, much older patients. So that is my role at the moment, and I think it's a very good topic to see what we can do better now and how we can expand the mental health in Barbados.
Okay, Camille, you want to give me your views? But Camille, as we go on this show, would you want to like to be referred to as Camille or Day? Which one?
Thank you very much. But yeah, I'm just happy to be here and give my perspective as someone who has been diagnosed and who has had to come from a very dark place to where I am now. So yeah, I just want to give that perspective and let people know that this conversation is important and it's for you. It's not just for anyone you might look at and consider mad, crazy, all those words that you use. It could be someone in your family, it could be a friend, it could be a parent. So that's it from me.
Okay. Carol?
Well, with regards to myself and being a patient in New York as well as Barbados, I can see where the resources are lacking. Yes, we are a third world country, but I don't think that means that mental health, because it is very necessary. And unfortunately, a time like this should not have brought it to the limelight.
Jomo, what are your opening remarks?
All right, good night, everybody. Thanks for being thanks for welcoming. Thanks for inviting me to the panel. I'm a couple and family therapist and a clinical social worker. I'm also a social work educator. I'm happy to be here, and I think one of the things is what I'm sort of hoping to bring to the conversation. I think this is an important topic because we are currently in the middle of a crisis which has an impact in relation to mental health, and of course that's the ongoing COVID pandemic and the current severe volcanic eruption and all the things that affects people. My work is to collaborate with individuals, families, and couples in terms of supporting people with mental health challenges. Because one of the things is that mental health has a relational or it has a family connection.
Okay, and Dr. Marshall?
Hi, thank you so much for having me. I'm Dr. Ashana Marshall. I'm a specialist family physician. I've been a doctor for just over 10 years now. And as a primary care provider, I'm aware that many patients actually present to us early. They present to us with symptoms that might not be clearly symptoms of a psychiatric condition. And so it is our responsibility as primary care providers to be able to differentiate and also to recognize that care has to be holistic. It can't be mental health just isolated and physical health just isolated. The body doesn't work like that. The brain doesn't work like that. And so I think that it is a privilege to be able to just expound on how these things are all linked and how these things can be better managed and identified in primary care.
Okay. Camille, you said you've been diagnosed as well. I don't know if you would like to share your diagnosis with us, and you're a mental health advocate. Can you tell us what would you say is the biggest problem in society right now in dealing with mental health issues in Barbados?
There are many problems. If you don't mind for the duration of the interview calling me Day, I would really appreciate it.
Okay, Day. Yeah, that's why I asked at the beginning which one you'd prefer.
Yeah, so there's fine. Yeah, there are many problems, and I think one of them has to do with people not being responsive, not being empathetic to the energy that people are giving off. So, for example, we may see people in a certain position, a tough situation, and we are quicker to judge than we are to try to understand where they're coming from and actually listen. Because I think that once most things are explained, they're very relatable. So I think just the lack of desire on most people's parts to just listen without judgment, I think is a big problem and a contributing factor, because on top of the things that that person is dealing with, they now have to deal with the fear, the stigma attached to what they're going through.
Interesting. Dr. Lustrick, same question to you. What is Barbadian society getting wrong?
Getting wrong, I would not say getting wrong, but maybe there is a lack. I agree with Day. There's a lot to do in terms of education to get a lot of self-awareness for the patients and awareness for the population and for all the Barbadians. What is mental health? There's a lot of stigma related and linked to the mental health that makes sometimes the diagnosis done quite late, with all the consequences of diagnosing very late. Also, there's a lot of myth. We can talk about that later, but what is getting wrong, or I would say what we are not getting enough, is educating that mental health is for everybody, and we are everybody in that, and that it touches everyone somehow. And therefore, we need to take this in a more friendly way and not see that as such a big stigma that will create so many barriers to tackle mental disorders. Okay. Then there's other points like the follow-up or systems that will be in between the hospital and the community, that they're in development, but they're not fully developed yet, and that those they will help to get the patients back into the society quicker.
Okay, and Dr. Lustra, what you just spoke about what is mental health. We hear all the time about good mental health. Well, now we know a lot of people are struggling. From last year, when the first lockdown here in Barbados, some people were laid off and didn't have a job for almost a year. And then just recently, our Prime Minister came out and eased restrictions somewhat, and people were feeling like, oh, things are going to turn around for me. You know, they pick themselves up and they dig themselves out of a little slump they were in. And then a couple of days ago, we had the volcanic eruption in St. Vincent and the Grenadines, and our hearts and our prayers go out to our brothers and sisters over there. But they also have effects here, and though we're hearing no work again, people are not sure how long this is going to last. So can you tell us what exactly is good mental health, and how can the average person achieve good mental health?
Well, the definition of mental health, there are many definitions. One definition of the World Health Organization is a state of well-being in which every individual realizes his or her own potential and can cope with stressors and can work productively. That is the definition. So when you see that, is so complex that at some point, as you said, we are all touched and we are all affected. We need to understand that mental health is a continuum. It's like going from green light to the red light. It's not just we are mentally ill or we are not. And we can have some issues and then recover somehow, or get to the other side, to the red light. Following what you just said, with all these stressors, obviously our mental health will be affected. And I would say that normally we say that 20% of the population somehow has mental disorders or mental health symptoms in some point in their lives. And I would say that at this time, we don't have the epidemiological studies done yet, but with the pandemic and in Barbados, with what is happening now, obviously, we are all somehow affected by symptoms that are related. It doesn't mean that we are mentally ill, but that we are not totally and cognitively, emotionally, and professionally at our best. If that is, I don't know if that is clear.
Yeah. Okay, Jomo, Dr. Lustra she just said that about 20% of the population are affected by mental health in some way. How do we pick up on poor mental health within ourselves and within the family setting?
I think one of the things that we need to be aware of is when we talk about mental health, we're talking about people's functioning. So one of the challenges or one of the things or indicators of mental health is when people's mental health starts to interfere with their functioning. So for example, somebody's anxious enough or they're depressed or sad enough that it starts to interfere with their ability to perform their normal everyday duties. And one of the things that we know is that mental health happens within a context. So we know, for example, that just in terms of getting people into treatment, one of the good indicators is family support, but also just in terms of when people are engaging in treatment and a recovery process, one of the other things that also helps in terms of people's recovery is when family is actually engaged. I'll give an example. One of the things that we know, for example, is, for example, if somebody who has a mental health challenge, so I'm talking about things like depression or schizophrenia, they come back to a household where there's high conflict, where people are very critical of each other, where people tend to struggle in terms of interpersonal relationships, they're much higher risk in terms of relapse in terms of that particular condition. You know, so one of the things that we know is if we're going to actually help people in terms of mental health, we are going to need to engage families. You know, if a person is within a couple system, then we're also going to need to engage their partner as well in terms of recovery process.
Okay, now you're talking about recovery, and the good thing we have Corel here. Corel, what can you tell me about the family setting and helping with recovery?
I can agree with to Jomo, that's his name.
Yeah.
I just want to make sure I'm correct.
Yes, Jomo.
Yes, I can agree with him in the sense that you do need family support, but sometimes support that you need some triggers and stressors that Dr. Lustrate spoke of. So even if you know that you need family support, it is, I think it's also on the onus of the caretaker, be it the doctor or the psychologist, to look into that same family setting and make sure that it is okay. And if it isn't, then to then find the outlet that with. I'm not going to straightforward or easy, but their recovery would at least be one step closer rather than simply assuming the household and family is okay. Because, as they say, some friends become family and some family becomes foes.
Okay, it's very, very interesting. Dr. Marshall, you are a family physician. Talk to me about the integration of mental health into routine and medical care.
Okay, gladly. I want to mention that I am in a unique or an interesting position in that before going on to specialize in family medicine, for a few months I actually worked in the Department of Psychiatry.
Okay.
And I it is my observation, and it has been my observation, dealing with patients who have psychiatric diagnoses, that there tends to be a lot of what I would call shunting. Like, okay, I know this person has a psychiatric diagnosis, so then all of a sudden it's like the psychiatrist will deal with whatever symptoms that person might be having. Or if this person has diabetes, so I will deal with the diabetes. And the integration aspect of it is omitted when you really can't separate out the two, because, for example, people with depression people with depression have like a twofold higher risk of having heart attacks. People with depression are more likely to have diabetes. People with diabetes are more likely to have depression. People who have mental illnesses are more likely to use substances that can lead to non-communicable diseases. And so when patients come in, their assessment has to be holistic. If somebody comes in presenting with symptoms of mental illness, sometimes it can be a complaint like a headache. But you said things have been rather difficult recently. Headaches that aren't going away, trouble sleeping, back pain, chronic pain. And if we just write up some painkillers and send that person home without taking the time to explore the experience of the illness as opposed to just the disease or the pathology that's right in front of you. Like, if you don't just if you look at the symptoms and not at the whole experience the person is having, you're going to miss it. And that is something that I think needs to be at the forefront of our minds now more than ever.
Okay, thank you so much. We're going to take a short break here and come back with the People's Business in just a moment. Welcome back to the People's Business Live, and we're so thankful tonight to have a diverse panel, and especially blessed to have people who can share their personal stories. As we said earlier, Corel is a Barbadian woman diagnosed with bipolar 1, and right now we want to get to know her story a little better. Corel, how old were you when you were first diagnosed, and tell us a bit about bipolar 1.
I was diagnosed at 22 years old. That was back in 2009. I was not diagnosed here in Barbados, as I said before. I was diagnosed in the United States. So when I was then starting my treatment here, I was able to university, and in being diagnosed over there and having to transition here, it was a hard process. The process that was hard was trying to find out for myself what bipolar 1 is. So as much as it is for the society to be knowledgeable in mental illness, you yourself as the patient, you need to learn about, unsure about, and you go to your doctors. You will be able to ask them a question. You will be, well, if a medication has been prescribed, how it makes you feel, if there are any side effects that then the doctor will then be able to fix right away to help, what should I say, to help eliminate anything that would be long lasting or long standing. And if you do your follow-ups, that you do your appointments, yes, it's hard. It's not easy whatsoever. And it changes your life for, I can say it will change your life for the better, because you will know how to navigate what you have now learned. And in relearning that, you relearn yourself. And that's the first step for satisfaction, or even the same goals that you may have had before you were diagnosed. It's not totally over. It's just a simple one step back, two step forward.
I know in previous conversations with you, you said you don't like the term episode, you prefer the term moment. So can you tell me what was your first big moment that made people say, hang on, something is going on here? Can you describe what happened in that time for us?
Yeah, so what happened was I went on Facebook, on social media, and there was no Instagram or anything back then. And I was posting different things. I was editing. So that sounded the alarm to people around me that something was wrong.
Yeah.
But necessarily, no, I was aware of what I was saying, the rate I was posting, how long it was going on for. It was only in the actual airport when I was about to board the plane, when I was on the plane, and I guess you can say I came to, and I was trying to ask the air hostess what's going on. Like I don't know what's going on. Can someone tell me? I'm not supposed to go back to Barbados till September. It's July. And rather than, I guess, a physician at the doctor, like how we have a community nurse here assessing the situation to escort me off of the airplane. It was not a very pleasant escort. I was handcuffed to the floor. It was scary for me, and that's not the best way to learn or find out that you have a mental illness, because first you have to get over that scarring of feeling like you were belittled or pride with strangers that you don't know. Just their first thing was defensive. It wasn't pleasant.
Who did you turn to immediately?
I would say that I turned to my cousin who was there in New York. And in turning to him and growing up with him from a child, it helped because he came still didn't see me as this crazy cousin or family member who had an episode on a plane. He was like, "Girl, did you know this and this?" He was trying to figure out for himself what happened. Yeah. So in him trying to figure out what happened and asking me what happened, then I found out what happened myself.
Thank you so much for sharing, Corel. Dave, would you like to share a bit of your story?
So, I was diagnosed when I was about 23, but I had been having moments prior to that, probably between 18 and 23, when I was in college in Florida. And while I was there, I was just having a really hard time keeping up. I was experiencing a lot of insomnia, or I would sleep too much. I would just sleep for the whole day. It would be hard to get out of bed. It would be hard to do anything really, if we're being honest. And that was frustrating because generally I'm a go-getter. I like to be moving and creating. But in those times, I had no desire to do anything. And there were also moments where, I was feeling like I didn't want to be on the earth anymore. Like if things would just be better if I was not on the earth anymore. And it was friends of mine who told me that I should go and get help. So fortunately, I guess it's a similar situation with Corel. My treatment actually started in the US as well. When I came back to Barbados, I was able to find a psychologist, but I think it was much harder than it should have been to find someone. It was at that time, it was kind of a case where I had to ask a friend to ask a friend. So that was one thing that I noted about care in Barbados. It was hard to find at that time. Um, and shortly after being diagnosed, I was diagnosed at probably the lowest point, and I was diagnosed with bipolar 2, which means that my depression is worse. And so it was at that low that I was diagnosed. And so shortly after that, I spent 2 weeks on ward C4 at the hospital. Um, and it was challenging, but it was also humbling because I noticed was that there were people on the ward from all kinds of backgrounds. There were older men, teenage males and females, older women. And so that really taught me and opened up my eyes to the reality that this is something that all kinds of people deal with. But since then, I've been getting a lot of support. I've been going to therapy consistently for a year. Has made the world of a difference, among other things.
Okay, and they, while I have you here, how is therapy going for you? You said that it's made the world of things for you. People quite often are very averse to starting therapy. Maybe someone that's watching this right now, they think they may probably be having a story similar to yours. They've never been diagnosed yet. What would you say to them about making that step and going for therapy?
I would say that this is something that is very difficult to deal with on your own. The way depression is, the more you keep to yourself, the more you feel it, the worse you feel, the more depressed you feel, and then the harder it is to speak. So it's one of those things that really can only be conquered by just sharing. And sometimes it's not the case where sharing with family or friends is gonna result in the best insight. Sometimes your family and friends just don't know what to say, and it doesn't mean that they don't love you or anything like that. It's just that they are not trained professionals. So from that perspective, I feel like going to therapy is just an intelligent thing to do. If you're sick, if your body is sick, you go to the doctor. And so if you're having difficulties with your mind and with your thoughts, similarly, you should go and get assistance. The other thing that I think is beautiful about therapy that people really underestimate is just by speaking your truth with someone who has just a completely objective look at your life, doesn't know you from Adam. It can do a lot, just being able to speak and say things out loud. A lot of what has helped me is just hearing my own thoughts and hearing it reflected back, and in a way coming to my own conclusions and learning tools to help me through the times that are harder. I think that's one of the main things, like getting those tools to deal with, because it's not necessarily going to be the case that you ever get less tools to have in those times to come.
Thank you so much for sharing, Day. One of the things that struck me when you were sharing your story is that you were talking about how hard it was to find professional help. Dr. Loostrike, is that still the situation in Barbados, and find it hard to find professional help for people going through these mental challenges, and why is that?
Okay. I think that they said very, very good and very interesting things, Corel and Day. It's difficult, it's getting a little bit less difficult now, but it's true that when I joined the hospital 20 years ago, it was much harder to find psychologists outside the hospital and engage into a therapy. Now it's a little bit better, but there's still a lot of way to go. They said something that is really important, and I would like to emphasize this point, the power of the psychotherapy. in terms of support, in terms of self-awareness. And I would say the power of the talking itself is extremely important. And I think you mentioned at the beginning how reluctant is people to engage into a psychotherapy or to go and see a psychologist or a psychiatrist. But that is crucial in the outcome of the illness. There's a lot of room for more professionals here, psychiatrists, psychologists, and certainly after this pandemic and this volcano eruption, we will have more demand, more requests, and more people in the need of coping, understanding, coping with the anxiety, not necessarily with the mental disorders established, but certainly with symptoms that they will require assistance.
Okay. I remember, everyone, the numbers to call if you want to contribute to the show are 228-5562 and 228-5563. Jomo, do you have anything to add to the whole therapy aspect of it?
Yeah, I think we've had some significant changes in terms of mental health in Barbados. I think one of the things is that we have moved to what we call more of a community-based model. This is in terms of the government. And I think one of the things is that in terms of that community model, mental health is more available. So in the public system, we have mental health as available in the polyclinic system. Of course, there's a psychiatric hospital and there's a specialized ward at the QEH. And we've also grown in terms of private mental health providers. So just in terms of listing a couple of those types of providers. So we have couple and family therapists, we have clinical social workers, and we have psychologists. And the mental health field has been growing, I think, particularly in the last 20 years. I think one of the things too is that we are doing a much better job, and this is I think this is as an entire community in relation to reducing mental health. I get a lot of calls from people, particularly younger adults who are much more aware of their mental health and who are much more willing to access therapy. Yeah. I'm really quite inspired in terms of just listening to Day and Corel in terms of sharing their stories.
Okay, Dr. Marshall, we're soon going to break, but do you have anything to add to after listening to the stories from Corel and Day?
Well, the first thing that I would like to do is just really commend them on just embracing the vulnerability and the bravery it would have taken to share stories like that. I can say that when patients come into the office, they're always concerned about how other people might view them, how other people might label them. So to come out is really, really, really helpful. And it is instrumental in bringing a lot of people into us and giving people the courage to do the same. I think that what they suffered from, it sounds like things that that we hear all the time, that we see quite frequently, more frequently than people will be allowed to admit. And Corel, especially her experience with people going on the defensive, and she said something very profound about having to select your family, because some people have families that aren't that supportive. And in fact, then when you get into the family and you dig into the family, you realize that there is a genetic history of mental health problem, or there is a genetic history of difficulties coping, or somebody disappearing, and people are not discussing it openly. I do agree with Jomo, though, that the younger patients that we tend to see tend to be more receptive to coming to a physician and saying, I think I'm having a problem, I'm really stressed out and I'm not coping. They're less likely to isolate themselves than the older ones are.
Okay, we're going to take another commercial break here. When we come back, we're going to head to the phone lines. Welcome back to the People's Business Live, and we're going to go to the phone lines. Good night. You're on air.
Good night.
Hi, good night. This is the People's Business. Go ahead.
Hi. Good night. I want to make a contribution. I want to ask your colleagues that is there. I want to find out from them. Now, people with the different stress levels and so on, if they want to turn to those experts that you have in the panel there, could you what will there be a fee or these things these you know what I'm getting at is that a lot of people are working and so on, and with the stress levels and so on, there are some people who might be saying that I would like to get help, but I don't have the money to pay a psychiatrist. I don't have the money to go to a psychologist, So I want to know if any of these experts who have in there, I want to hear from them if there's a cost to people that need their help in these type of times.
Thank you so much for your call, sir. I guess he's asking if there's some sort of pro bono clinic that you can go to if you need mental health assistance, but you don't have the financial wherewithal to do it at the time. Who wants to take this one?
Yeah, I can start. As I had mentioned earlier, there are some services that are available. We have services both in the private, and of course there's a cost attached to that. There are a number of practitioners in the private practice. Some of those practitioners have sliding fee scales, but we also have a range of services that are available in the public sphere, and that includes at a psychiatric hospital. People can visit. I know Dr. Lucia can talk about this in more detail since she's there. But people can visit and get an assessment and access services, and of course we also, which is a nice thing, that there's a decentralization of mental health services. So services are also available in the polyclinic system as well.
Okay.
Yes.
Dr. Lustrick, you'd like to add to that?
Yes. Actually, at the psychiatric hospital, anybody can come and present at the admission and assessment ward, and they can discuss with the doctor that will be on call, and the doctor will decide, the psychiatrist will decide what is the best way of going with this. I think the question of the person who called also is related to the fact that now it's not only, and I think that is very interesting, that it's not only at present the stress. He's asking also, is this stress a cause for a mental disorder later? And I would say yes, and this is part of the prevention as well. So that is a very good question, because when there's a lot of stress, and we are all having a lot of stress, but some are not coping that well, is a very good position and idea to go and seek for help. And you can go to the psychiatric hospital, you can go to the polyclinic and try to see how this can be organized besides the private sector.
Okay, let's head back to the phone lines now. Welcome to People's Business.
Hello, good evening.
Hi, good evening. You're on.
Good evening. Yes, my name is Buddy Laria, and this topic, time to invest in mental health, is very dear to my heart. I have been struggling to get a discussion going seriously on mental health in Barbados for some at least 35 years now. And that is because my interest in mental health go back to 1977 in England. Like just the two sisters, they had their experience in America. I had my experience in England. And what I found out is that we as a people are psychologically damaged based on our history and what is now happening with the COVID and now with the present situation with the volcano. And I have been writing to the Ministry of Health. As a matter of fact, I put forward a project on mental health to the former Minister of Health, Mr. John Boyce, and I know that there's some work was going on, but the time has come to really invest in mental health.
Okay. Thank you so much, sir. I know that you're talking about investing in mental health. Normally when we talk about investing in something, our mind normally goes to the physical, and we're thinking about the physical in mental health in Barbados. One of the most noticeable places in Barbados is the psychiatric hospital. Now, a lot has been said about it over the years, and the commentary hasn't always been positive. Dr. Lustrick, what is your honest opinion on the psychiatric hospital and its effectiveness in 2021?
Well, I think that is a myth that the psychiatric hospital is a myth that is in the society here. It was called the mental and many other names. The truth is that the patients, they have very good care. The nurses are wonderful and they are very committed. So I would say that it's more a myth than a reality. It is true that actually at present, we have a protocol that is quite difficult because the patients, they need to isolate. That makes the situation more complicated with the interaction with other patients and with all the system. But to be honest, I think that they get a very good care. There's a lot of things that they could be and they need to be improved, but they get a certain care that I think is valuable.
Okay. Well, Carol, you just heard Dr. Lustrick's comments on the psychiatric hospital. You have been a patient at the psychiatric hospital yourself. Can you tell me about it, how many times you've been there, and in your opinion, what works, what doesn't?
Why? Everything is not necessarily a myth, as Dr. Lustrick said. Yes, there are some nurses who are nice. Yes, you do get good care. But at the same time, you still have the stigma within the hospital. I don't think it's a myth helps the situation. It doesn't. Because people who have gone through the experience themselves, including me, who knows it's not a myth. Not a myth, just like how what was recently highlighted at the Girls Industrial School. I have PTSD from being admitted 3 times, and I was admitted there. Yes, I was probably not well, but the same thing how I said earlier about failure to look into what the strategy might be, failure to actually get them to know the patient as a person rather than seeing them point blank while they're having a moment are scientifically correct for a nurse or a doctor or even an orderly to judge them. So I do disagree in her entirely saying that it's a myth. Yes, you do get good care, but you get good care from those who care.
Well, what was your experience, Carol?
My experience wasn't a good. I don't necessarily want to tap into it too much because I don't want to highlight it, but if I had PTSD from it, that can tell you that it wasn't a pleasant one. And if I can sit here and tell you that resources are seriously lacking, yes, patients have to be isolated, but where are they isolated? Are they isolated? No, they're not.
Okay, thank you for sharing, Carol. Jomo, what are your thoughts on our institutions?
I think we have improved in terms of mental health access, but there are always gaps in terms of services. I think one of the challenges too is seeing the importance of mental health, and that mental health is just as important as physical health. And I think we've underinvested in terms of mental health, particularly with regards to the development of facilities. Now, I know that's changing, and I'm really appreciative of Dee and Corel in terms of that mental health advocacy. I think it's going to be really important, particularly for people who access and utilize mental health services, to be voices in terms of change with regards to mental health.
Okay, we're going to head back to the phone lines now. Good evening and welcome to the People's Business.
Hello, good evening.
Good evening. Go ahead, sir.
Yeah, I wanted to say I suffer with ADHD, and I wanted to ask more. Why is it so hard for people to get jobs that are known to have mental problems? I find it like people have to hide that they have a mental problem or hide that they go to the psychiatric hospital and stuff like that in order to get a job, in order to get anywhere in the public area, even to, have, like, when you go to the polyclinic and stuff like that, and you want to represent yourself or speak for yourself, once they hear that you have a mental problem or you have a issue, I find that it's very difficult to be able to speak for yourself once they know that you have an issue. And I just would like to know, why is it that people with mental illness are treated as though they are like criminals? I would say use that word criminal might be a strong word, but they're treated almost like a criminal, because if I have a mental illness and I say, well, I'm going to the gas station to apply for a job, they're most likely not going to hire me because they heard that I have a mental illness and that I've been to psychiatry. It doesn't matter what it is that you have. The mere fact that you've been to the psychiatry, you have a mental illness or whatever, they just don't want to give you the chance to even try.
Thank you so much, sir, for highlighting this. We're going to get right into the responses to those comments and those questions from you when we come back from this break. Welcome back to the People's Business Live. We're looking at investing in mental health. Just before we went to the break, a caller made a very good contribution. He spoke about the difficulties in getting a job after people have known if you had a mental health diagnosis. Corel or Day, we'll probably start with Day first. Has that been your experience?
Well, I think my experience is unique in that I've never really applied for a job. It's not been my interest because I'm a creator, I'm self-employed. So I think I've been blessed in that respect. But I do see how that could definitely be the case. I want to also emphasize what Corel said, which is, yes, we have these institutions, but I don't think it's enough to say that we have them. And I also don't believe it's totally open to say that it's a myth. I was on C4, so I wasn't even at the psychiatric hospital. But I feel like even in that, there were moments where I felt like I was having a stigma against myself. So I can only imagine that someone else may stigmatize someone who is diagnosed with any kind of mental illness.
Okay. Corel, have you found it difficult in terms of the world of work?
I have not necessarily found it difficult in the world of work. I would more say that when I did from the US, I would be very open and I would say, yes, I have bipolar, and obviously no one called me back. So unfortunately, I had to do a don't ask, don't tell approach, not because I wanted to, because I had to. Part of getting better is having a normal life or normal aspects of life. I have to be cooped up in a house and I can't be the lawyer that I want to be. I can't be executive I want to be. I can't be the chef that I want to be because I have to be scared to let people know this is what I have been diagnosed with and this is why I have to do it. Jane said, yes, I have been to C4 as well, and I can commend for in better conditions than the psychiatric hospital. But yes, whilst I was there, I was also stigmatized as well.
Okay. Thank you again for sharing, Carol. One of the points the caller made, we have another call on the line, but before we get there, I just want to engage Dr. Marshall. He was talking about this, the way people looked at you. And I know quite often we may associate people living with mental health issues with a highly noticeable appearance. Dr. Marshall, can you tell us about how mental health problems can present with physical ailments?
Yes, definitely. I do sympathize and empathize with the caller because you can tell that he is quite stressed and frustrated.
Yeah.
And what he is describing, unfortunately, is not a unique or isolated situation. And I just want to put out the reminder before going on to the symptoms with which people can present that it is not legal to discriminate against someone for having an illness. And also, you are not obligated to disclose an illness. I remember a mental health professional saying to me once, and it stuck with me, that you disclose out of a position of power and not out of a position of fear or feeling backed into a corner. Of course, the challenge with that is it is difficult to prove that that is the reason you didn't get the job, or that is the reason that that you were not advancing in interviews. But I just wanted to be very clear that it is not acceptable to reject someone based on their medical illness, just like how you can't reject someone based on diabetes. People who have mental illnesses present to primary care in many different ways, and the majority of the patients don't come and say, I am depressed. They come and they say, well, I have headaches, or I have trouble sleeping, or I have pain in my neck, or I haven't been eating, or I feel tired all the time. Fatigue is a very big complaint. I might have chest pains. I think I'm having a heart attack. People present with those kinds of complaints, back pain that isn't going away, my whole body's hurting, and then sometimes with certain anxieties. I think I have cancer. I think I have, I think I have something growing in my brain. Sometimes patients tell you these things and present with the physical complaints, as opposed to, some of them are aware that they're having mental health challenges, but they want to feel out your response. They want to see if the doctor is willing to listen, if the doctor seems judgmental. So really and truly, once rapport is established and you ask questions, sometimes you find that patients will then say, well, I haven't been coping with XYZ, or really and truly I'm under a lot of stress, and I think that might be causing some of the problem. And then sometimes patients don't relate these things to mental illnesses at all. And then once you try to say, well, at present you meet criteria for depression or for anxiety, some patients are taken aback, some know, but they don't really want to accept it because of the implications. And some say, oh, well, if that's the case, then that's fine, you know, like it minimizing it because they don't feel like it carries as much weight as having a diagnosis where somebody can stick your finger or pull your blood. And that is something that is challenging in primary care, to get patients to feel like even if they're getting a mental health diagnosis, to feel validated and to feel like their complaints are legitimized and to feel like there are people willing to work with them. But those kinds of symptoms are definitely the way people tend to present in primary care.
Okay, thank you, Dr. Marshall. We're going to head back onto the phone lines now. This is the People's Business. Good evening.
Good evening. I am going to make a twist or make a statement that may be a twist. I'm going to deal with the subject of postpartum. And listening to Dea and Corral, and, you know, especially Dea, when she mentioned her experience on C4, that took me back to 18 years ago as a parent, and I was warded there. But my mental health was not similar to bipolar. They were checking me for postpartum, and I want to support them sometimes. You know, the atmosphere, I can say that Dr. Jomo, he said that yes, that certain things have improved. But I would like to share my experience there. As a mother, a 3-week-old baby, and you are sitting in there, and they're testing you for postpartum. You are among males and females, and you know, you feel lonely. You are alone, yes. Your family and so on can visit. There's freedom there for the baby. But what has improved have our government, Ministry of Health, looked at, as you said earlier, and improvements where parents are concerned, because postpartum is a mental health issue also. As I said, mine was for observation. Thank God it was not something that took me over the deep end. But I want to support Corral and Dea and tell them, yes, that there is something that most persons do not like to highlight, but I am with them. I like to talk about my experience 18 years ago. I think we are too closet in certain things, and mental health does not mean that you don't relate, that you cannot go home and cook. It's just at that moment in time, your whole structure, your body change, your way of thinking. And sometimes the observation is not always correct. As I said, mine was for observation, but I was very well in tune with who I was interacting with and things like that. So I would say to persons over there, do not stay in the closet. If you are supposed to go for treatment, feel free to present yourself. I had no choice. I was given a time frame to get to the hospital that evening. You know, I was treated, as I said, it was 18 years ago. I was able to go home, pack and so on, and I spent my time there. Family was, you know, they were able to come. But one of the fears that I had there is where the males and females that we are warded just on that ward. I don't know if it's going forward, if there can be a separation or if there is one. But I think I heard they mentioning that the males and females seem to be still together. It was wholesome. You get to share experiences and things, and you know, you pray and things like that. But as Perez said, there are certain things you will not like to discuss. But if you say things, use certain key phrases, you know, you were not comfortable, sometimes things that would have been said to you at that point, you would not like to hear based on your physical and mental being at that time. But I'm going to say to the panel, keep it up. The discussion, I think, is wholesome, healthy, and I trust that more persons will call in if we have more time and share their experiences also.
Thank you so much for sharing, ma'am. Dr. Lustrick, can you talk to us a bit about postpartum and its prevalence in Barbados?
Okay, postpartum disorders are very important and to take into consideration. There are different kinds of postpartum mental disorders, the depression, the psychosis, and we have some at the psychiatric hospital, but mainly they are seen at the QEH once they give birth at the moms. I had some that they were admitted at the psychiatric hospital. That is important because it could be the trigger to a more long-lasting mental disorder. With the postpartum, there's also a period that is called the blues, the postpartum blues, that is not necessarily an illness that it will develop by itself and will remain, but it's a period of where it needs the mom needs support and care and a lot of support really in terms of therapy. Once it develops an illness, well, it needs proper treatment and a long-term follow-up. I would like just to mention, going back to what Karel said, I agree entirely that the experience of any admission at the hospital, in any hospital or any admission, is quite traumatic. So it's not a nice thing to need to be admitted into a psychiatric unit, into any unit, into the hospital. Surgery is also very traumatic. What I wanted to say is that you can get treatment, and certainly you get care. It's not that you go into the psychiatric hospital and it's a terrible situation. Always. It's true that can be very traumatic. So that is just to go back. The problem there is that the stigma attached to going to the psychiatric hospital, the stigma attached to mental disorder and mental health, and go to see a psychiatrist in this island is still extremely high. So all the patients are very reluctant and all the families are very reluctant, and any admission becomes even more traumatic because all this stigma attached to the mental disorders, including the postpartum as well. Huh?
Thank you so much. We'll be taking another short break right now and back with more debate on the people's business. Welcome back to the People's Business Live, and I want to go to, we spoke about the workplace. I want to talk about schools a bit. Jomo, what can you tell us about mental health in the schools? Because especially with people at a younger age who may not know what's going on with them, adults sometimes, as we've heard during the discourse tonight, they don't know what's going on with them. What do we know about mental health within the schools and the response that we have in our educational setup?
Just in terms of respond to your question, Shane, there are mental health resources that are available within the school system and at the Ministry of Education. The Ministry of Education has employed social workers. They have a social work team, and they also have a psychologist on staff. And just in terms of teachers interacting with children, I think we've we've been orienting teachers in terms of being able to start to identify mental health issues. There's also the role of guidance counselors as well too. I mean, there are challenges to it, and I know one of the things is that we've had some major changes in terms of school with regards to school being online, all the stressors that go with that. I think we are going to need to account for just some of the challenges that people have had in terms of not having the structure and not having the formal system in the last couple of months as a result of this pandemic.
Okay. It's interesting that both Corral and Day identified that they were diagnosed in their 20s. But now we're talking about school. Can either of you look back at any moments you might have had in school days? Maybe you might have been bullied because of something you might have done or something like that, and looking back at it now say, I may have been struggling with this particular issue from a long time ago?
Okay, so I'll go first. Not entirely. I think a lot of the challenges I had came a lot later, just because from late teens on to my early 20s will be the time that I was trying to discover myself and coming face to face with the things that could not reconcile. I think is more so what prompted a lot of the struggles that I was having. So I can't point to anything in primary or secondary school. I feel like my experiences were pretty normal and a pretty common experience for any child at that age.
Okay, what about you, Corral?
In third form, and it was either fourth or fifth form during, I think it was our first period of school, and I decided to take, I think I took a bunch of Panadol or Boralgin. So I did have a suicide attempt at my actual second while in taking me to the sick bay area, calling in my parents, letting them know what happened. But I can honestly say that the same thing where there's family support and support from friends, it was still an issue within my own family help and who thought that I didn't need help. And I think that should have been out loud cry for help in order to handle the situation then.
Okay, so Corral, if a young girl is watching this right now and with her parents and may have a similar situation, what would you say to a parent in terms of a young child expressing that something is wrong?
Well, I can say to the parent or dad, it can also be an aunt, an uncle, or even a great aunt. Who you feel most comfortable go to that person. Yes, even if you may be scared to do it, you are going to be scared to do it, but you're still a child and they're an adult. Then they will be your adult voice out there to the other ones who want to disregard what you have to say or how you feel. So even if you are not comfortable speaking to the person next to you, there is some person in your same family unit that I'm sure you may be comfortable with, or even if it's a family, friends tend to be an uncle or an aunt, even if it is not by blood. And it will go a long way because there are those people who probably went through the same thing and they never spoke about it either. So in your experience and wanting to be your voice will go very, very
Okay,
very
beautiful.
long.
Beautiful, Corral. We're going to head back on over to the phone lines now. This is the People's Business. Good evening.
Good evening. I just want to know, how do you get help for some person that doesn't know that they need help, and is there any way else besides going through the Royal Barbados Police Force?
Who wants to take a go at that?
Well, I can go ahead, Dr. Marshall. You're on the first line eventually for that.
So the question is an excellent question. In order to answer the question, better, more detail will be needed, but I can just give general I can give some general advice. So if someone is competent to make decisions, you can encourage them to make the decision. You can encourage them to see someone. You can encourage them. Like some people will not want to see psychiatrists or psychologists because of the stigma initially, but they'll be willing to go to their family physician or a general practitioner. If it is a situation where the person is a danger to themselves or a danger to others, or if you as the one looking after them feel in fear of your life and in fear of some kind of harm, you can contact a psychiatric professional, you can contact the psychiatric hospital. There are community health nurses who will actually come out into the neighborhood, and I know a lot of people aren't aware of this, and who might engage the person and make an assessment in the comfort of the home. Sometimes that can be arranged. Like I've arranged that for people as well. I have made contact with the psychiatric hospital. If it is a situation where the person is in immediate danger to themselves or immediate danger to others, then that, yes, does require more aggressive intervention. But the Royal Barbados Police Force, most of the time, that just becomes involved if the person is just immediately a threat to themselves or others. But there are other options available.
Okay, I hope that answers the caller's question. We have another caller on. Good evening and welcome to the People's Business.
Yes, hi, good evening.
Good evening.
Yes, I am dromophobic now for the past 10 years or so, suffering from dromophobia. And I usually go to the psychiatric hospital to see the doctor and so on. But since COVID, I haven't been and stuff like that. And it causes a lot of stress and stuff in terms of cross the street. I cannot cross the street. I have to drive every place that I go. Right. Is there another clinic in the psychiatric hospital that I can attend basically so as to ease this situation?
Okay, and Dr. Lewis, okay. Go ahead, sir.
Yeah, I'm not sure if there are other persons in Barbados who suffer from dromophobia. I'm the only person I know that complains about it.
Can you tell us a bit about it?
Well, you think when you're trying to cross the street, you don't care how small the street is. It can be a very difficult situation, and you tend to you tense up and you feel like you're going out of your mind. You would freeze and freak out there. You can't get half the road across. Anything will come and hit you then. I can't directly explain any better, but you just freeze.
Oh.
Right? You just cannot cross the street. I've been reading on it and stuff like that, and for some people it's like a quick fix. Some people get to the doctor and it's quick fix to walk with them and do an on-site thing, And I've been through the on-site situations and so on, but it's a very difficult thing. For me, it don't seem like a quick fix.
And how long has this been a challenge for you, sir?
Around 10 years, 10, 11 years, and so on. And the clinics at the polyclinics, I don't really like going to them, though they could be helpful. But then you got to pass around a lot of different people. I suffer with dromophobia, yes, but I think there's some other fears going on in there, because even when I have to pass through the aisle with people, then I don't want to do that, And I don't know if it causes me to have a look on my face when I'm driving, but then you driving, sometimes you hear a fellow say, "But that fellow look mad, yeah." You know what I mean? So the stigma, I'm laughing out, but the stigma that's associated with people with mental illnesses, it's terrible. Turning to a psychiatric hospital, I have no problem with that. I go there almost every day. My wife works there, right? So I believe that something needs to be done in terms of dromophobia or anything like that, or if there are other people who suffer with this thing that I can talk to that might make it easier.
Okay, thank you so much for sharing, sir. We're going to take another short break here and come back with our wrap-up. Welcome back to the People's Business. And before we went to break, we had a caller who said he was suffering from agoraphobia. And I just Googled it quickly, and it said sufferers experience anxiety even though they realize that streets, highways, and other places pose no threat, but they still have a fear. A fear of crossing streets is termed agoraphobia. Dr. Lustrek, he was mentioning that he was looking for someplace else that he could go to be treated. Do you have any advice for him?
Well, for all the patients, they can be treated either at the hospital or at the polyclinics in terms of what is related to the psychiatric hospital and what is public, or at VH. Otherwise, it will be the private sector. It is important because in this case, all the phobias that are the form of anxiety, very severe, they need a more holistic treatment and not only medication. Sometimes they can be treated without any medication as well, with cognitive behavioral therapy. But that requires to see a psychologist, and that sometimes is a bit difficult to get a proper and continuous follow-up for all the patients that they need this kind of treatment, because it can't be done every month. It needs to be done on a more regular basis, and that it will be a little bit more a challenge to get everybody treated in the community. But the psychologists, as Jomo mentioned before, the psychologists are now also seeing patients in the community as well. So for the public sector, it could be the hospital, it could be QEH, or it could be the polyclinics.
Okay, wonderful. I would like to, before we close up, I would like, because we have such a diverse panel, I'm loving it tonight, and everyone has different takes and a unique angle from which they're seeing how we deal with mental health issues. Before I get into that, I just want to take another caller. We want to get in. Everyone wants to get in on this topic. We're going to try to let as many people contribute as they can. Good evening and welcome to the People's Business.
Good evening.
Good evening.
Yes, and I think you have put Peter on hold.
Go ahead. You're live, sir. Go ahead.
Oh, I'm on the program.
Yeah.
I'm still hearing Dr. Lustrick speaking. Wait, he's finished.
Okay, listen to your phone, sir.
Yes, please.
Yeah. Go ahead with your question.
Yes, please. Concerning the person that called about the type of admission, when somebody needs to be admitted to the hospital and they don't know that they're sick, there are many ways. One person that knows can present themselves as a voluntary patient and can sign themselves in. The second type is where the person does not know what's going on. The family can take them to two doctors and get two doctors to sign the form, and then the person can be admitted on the request of the family. Mm-hmm. There's another way where the community nurse is involved. when the community nurse is involved, this is a emergency order. In that case, where the person is in immediate danger to themselves or the public, that community nurse can sign an order, and in this case, the police can assist them in taking that person to the hospital. On the other hand, the reason why the things in the hospital are what they are not enough investment in the mental health illness. Because if you go to the QEH, you have ENT specialists, you have gastrointestinal specialists, you have a lot of specialists. The same should go for the psychiatric hospital, where they have psychologists, social worker, and so on.
Okay, I'm sorry, I think we lost that caller. Thank you for the contribution, sir. But before, I was saying we have a diverse panel, and I would like everyone to give some tips, their own tips of what they think helps for mental health, and people at home that are watching that may be wondering how they can handle their own mental health issues and challenges they've been having. Dale, let me start with you.
Yeah, so I would just say that for me, what has helped is attempting to make good decisions every day, the small decisions. So, for example, that might be waking up, not feeling like getting up, but still making the decision to get out of bed, open the windows, go outside, have good nutrition. All of these things are just small habits, but when it all comes together, it can have a huge impact on the way you're able to deal with difficult situations. But I will also just encourage people to get the help. Therapy has been very useful. And if it comes to it, be willing to take medication and open your mind about it. Another quick thing I like to say is I think there are ways that we can use social media to really help with this situation. And on an individual basis, I think we just need to generally audit what we let into our mind. And so it might be a case where you need to detox from social media. It may be a case where you need to unfollow accounts that trigger you and instead follow more wholesome accounts. So that would be my biggest tip.
Okay, thank you so much. Jomo, what would be your tips?
My biggest tip would be to engage your family. I think one of the major resources that we have are the people that live under our roof. And just as Carell said as well, too, family doesn't have to also be under your roof. It could be people that you're also connected to in terms of relatives. One of the things that we know in terms of mental health recovery is the more support we have, the better we do with regards to the recovery process. I mean, I'm a couple of family therapists. I'm in private practice. And there are a number of other mental health professionals that also engage families as well.
Okay. Dr. Marshall?
Yes, I would like to say that intervention the first step might be just self-awareness and recognition and taking responsibility for improving your own mental health and well-being. Like, I'm a doctor, I'm a mother, but I'm a human being first. You might be a government leader, a news person. Anybody that is experiencing stress has to realize that despite what you have experienced in your past, what has controlled you, what has derailed your present, what you're being faced with, you are worthy and worthwhile enough to just look for the help and to make the little efforts. Like they would say, small decisions, things like exercise or improving diet or just talking to someone, even if you're not sure how it might help, even if it's not a problem that seems solvable to you, having an objective opinion from someone who's not quite in this situation can be very, very helpful. And we all deserve to live, comfortably and to have a better quality of life than some of us isolate ourselves and have.
And Dr. Marshall, on tips on coming to your doctor and speaking about things that may be bothering you and you may not want to speak to your doctor about and not know how the doctor will react.
Okay, well, I've done family medicine, and we put particular emphasis on what we call patient-centeredness. And patient-centered approach is where the doctor and patient have equal roles in the relationship, in that I know my role is to listen and to validate you and legitimize you, and your role is to communicate honestly and open with me. But obviously, if the patient doesn't feel comfortable, that won't happen. Going to the doctor, sometimes it can be helpful if you are a more courageous person, or if you are confident enough to just be upfront, or to focus on how the things are affecting you. I remember early up in the segment, someone said something about functioning, but I also want to point out that some people with illnesses, or mental illnesses, are very high functioning. And so there are the people who seem very well put together. There are the people who are the life of the party. There are the people who, and so sometimes it's to have just the bravery to present and let down that facade and say, well, I am struggling. I am having an issue. I am having a hard time. I don't know what it is. I need help. This is how I feel. And the conversation can start from there.
Okay. Dr. Lustret, some tips from you?
Well, I think they said quite a lot of very interesting points, but I would say that once you have a mental health issue, whether it's small, medium, big, recent or not, you have always two options. You let the symptoms drive you and control you, or you are on top of that. And to be on top of that means to do all what they just said, all my colleagues, and they and Jomo, is just to do whatever you need to do to get on top of your illness, to control it, to get a very healthy life. Sleep is extremely important. I think it was mentioned. To get a very hygiene, nice, a good hygiene of life, a good hygiene of sleep, good exercise, good and healthy food. All those things added up, they make it a huge difference. If you follow up with therapy, psychotherapy, if you need medication, to be compliant with your medication, to get your family or your surroundings all the support, to reduce all the stress, to avoid as much as possible all the stressors, to get out of all the abuse, and as much as you can, all the abusers. And that is to be more on top of your illness. So that will be my tip, is you control your illness instead of allowing your illness to control your life. And as Dr. Marshall just said, when you do that, and we have here two persons that are succeeding a lot in life and excelling in life with mental disorders. If you have a mental disorder, it could be extremely high functioning anyways, and it's nothing to do with your mental illness if you look after yourself and what you need to do.
Okay. And Corral, the final word is with you.
Everything that everyone said is applicable, but most importantly for me, I would don't say, oh, I'm this, so let me do this. Medical profession is there for a reason. If you don't feel comfortable with the person you've been assigned to, or you've been found privately, find someone else, get a referral, express your emotion, even if you are afraid of being somehow reprimanded for it, because in speaking up, I think you also works for you. What works for me, I can say, is sometimes I journal, sometimes I listen to music. Most people with mental illnesses are also found to be creative, so there is a positive in what has been portrayed as a negative. And it's also on the doctors to help bring this positive out and to limit as much negativity.
Okay.
Spoke to you about people who you thought were close to you and they actually aren't.
Okay, thank you so much. And thank you for joining us tonight as we discuss the ins and outs of mental health in Barbados. And thank you to the wonderful panel. We had insightful and thought-provoking discussion. And thank you to our viewers both on CBC TV 8 as well as online. I'm Shane Jones. Good night and be good.